Hello everyone. Welcome back to Dr. Meenakshi's Medica. This is Dr. Meenakshi, BMS MDIU, Ayurvedic pediatrician. So in my last educational video, we saw what are genetic disorders, right? So from this session, we will start one diseases which all comes under the category of genetic disorder. That is, first disease is Down syndrome. As we saw, genetic disorder is maybe due to bija bhaga avayava, that is the sperm or ovum or whole nucleus, for example, or the inside particular maybe chromosome or genes. Any defects in these parts will form some complaints in uh, future baby. That baby will be diagnosed as some one or other disorders. That is, first one is Down syndrome. What is this Down syndrome? This Down syndrome is one of the common autosomal trisomy in which the 21st chromosome will be triple in number. As we know, we have pairs of chromosomes, right? In that 21st pair of chromosome will be triple in number. That is XXX, XXY. This one extra chromosome will be present, triple. So it is named as 21st chromosome will be trisomy, in which this is the main cause. 21st trisomy is a main cause, and especially the 21st chromosome defect is the defect in chromosome will be like non-disjunction or translocation or maybe mosaicism. These are the facts which causes the mental retardation or any defects in the part of a body. Especially in these three, non-disjunction is very common. 95% of Down syndrome babies will be due to this non-disjunction of a chromosome. And identical features, how we can diagnose or how we can diagnose these complaints as a Down syndrome. The clinical features, what we say, especially it is categorized under dysmorphic features and other functional and structural abnormalities. So we will see what all complaints or what all changes we will be having in dysmorphic features. Especially again it is divided as dysmorphic facial features. What all dysmorphic facial features we will be having is flat face, upslanting palpebral fissures, brush-filled spots in iris, flat nasal bridge, small oral opening with protruded chin, small retro placed chin and short ears, high arched palate with small teeth. The tongue will be scrotal tongue. So these all are facial dysmorphic features which we can identify in Down syndrome babies. Other dysmorphic features of body are microcephaly with flat occipital, short stature, short sternum and short genitals, short and broad hands and fingers, wide gap between first and second toe, single palmar criasis known as simian criasis. That is, usually we have three palmar criasis, right? These lines. But in Down syndrome babies, there will be only single palmar criasis. So these are the other dysmorphic features. Now let's see what all complaints or identification we will be having in functional and structural abnormalities. The other functional and structural abnormalities are hypotonia of the skeletal muscles, developmental disorders or developmental delay with mental disorder, cardiac defects like endocardial cushion defect, abdominal problems like duodenal atresia, and hypothyroidism. These are the other abnormalities of a structural or functional defects. So these are the clinical features or findings we will get in Down syndrome babies. Obviously, as it's a chromosome defect, we can't treat it fully or we can't cure it fully. It will come under asadhya. But asadhya means the baby will not die. We can't treat the disease fully, but at least we can give a supportive treatment like according to symptomatic treatment, like whatever complaints the baby is having, according to complaints we can treat or we can cure the complaints or we can subside the complaints, but fully we can't treat it or cure it because it's a chromosomal defect. But if we didn't treat or if we didn't give any supportive treatment also, then the baby may go for complications. Even in complications, baby may have death or chronic rhinitis or conjunctivitis or periodontal issues. These all the baby may have in complication stage. So obviously, we should maintain these babies with supportive treatment. And if you go for modern medicines, obviously they will give steroid or they will give any according to pain analgesics or at last supplements like multivitamin. But if you come for Ayurvedic treatment, at least we can go for any Panchakarma procedures to build a, however, in complaints or diagnosis, identification, we saw that baby will be having hypotone muscles. So by our Sarvanga Abhyanga or Svedana or any supportive Panchakarma procedures according to the baby's Prakriti, according to the baby's tolerating capacity, at least we can give a supportive treatment to a baby. So this was about the Down syndrome, its clinical features, and obviously not a curing treatment, about supportive treatment. Thank you.